There are many questions and fears concerning the impact that the COVID mRNA shots have on female fertility and also on the children they are going to have. So some of these really important questions and fears are, how do mRNA COVID shots impact women's fertility? That's one. Another one is, how do they impact the likelihood of women, once having conceived, giving birth to a live baby? And then thirdly, how are these babies, the ones that are born alive, how are they affected by the vaccines that their mothers received either pre-pregnancy or during the pregnancy? And there's a bunch of recent studies out there that provide some answers. And I'm really happy that I have Nicolas Hulscher here to look at these studies and discuss their findings. So Nick has already written about all of these studies that we are going to discuss on Dr. Peter McCullough's Substack, Focal Points. And so welcome, Nick.
Thanks for having me.
All right. Let's start with the study that is called Impact of mRNA and Inactivated COVID Vaccines on Ovarian Reserve. So that's a study that came out in March 2025. So it's a pretty new study. And the objective here was to find out how Pfizer's mRNA COVID shots, as well as inactivated COVID-19 vaccines, impact the ovarian reserve in female rats. And I'll let you talk about this, Nick, about the method, what did they actually do, and then let's go into the findings. And when we go into the findings, I'm going to share my screen so that we can actually look at the findings.
Yes. So this study, this honestly, it came out in March, right? And honestly, it went under the radar. Nobody really reported on it for about a month or 2 months even. And so, when I was scavenging through PubMed and I saw that study, I was like, wait a minute, I've never seen this study yet. And I clicked on it and I was shocked, right? Because these findings, I wasn't really expecting to see that much damage. So what they did was they injected these rats. I think it was 10 rats per group. One with the mRNA shots, one with inactivated virus injections like the Sinovac vaccines in Asia, and then the placebo groups. And the mRNA vaccinated rats, after 2 doses, they received human equivalent doses. So that, they didn't receive the same, so they didn't take a Pfizer injection and inoculate it with what they would give a human. They made it much smaller and kind of, tried to make it equivalent to see if the findings would be better reflective or better translated from the study. And so they gave it a smaller dose. And these rats literally lost 60% of their primordial follicles in the mRNA vaccinated group. And we know that these follicles don't regenerate, right? This is the finite version of them, the one that all women are born with. And they just simply put, do not regenerate. And so if you wipe out more than half of that ovarian reserve, it's going to leave grave implications. And we can go into that other study later, the human data, where it is now reflective in that. And so, very, very disturbing findings. And I can't believe that they didn't test this before they gave it to the majority of the population.
Yes, an interesting, good point. That really is hard to believe. So these primordial follicles, these are like the potential eggs, right? This is like the egg reserve. I mean, it's not a fully formed egg when a baby girl is born. They have like 1 million to 2 million, something like that, when they are born, I believe. And then it goes down, it decreases. So I think around puberty it's like 500,000 eggs, and then short before menopause, it's something like 1,000 of these eggs are left. But they form during gestation, and once the baby is born, that's it. It's a finite reserve, as you said. All right, so I suggest that I'm going to share my screen, and we'll go into the study and have a look at that. So there is the study, impact of mRNA and inactivated COVID-19 vaccines on ovarian reserve. By the way, that was interesting that they used an inactivated COVID-19 vaccine as in one of their control groups. So this is, if I understand that correctly, that is the traditional vaccine using an inactivated agent. So like, the kind of vaccines that we're used to, not the new mRNA technology. Is that correct?
That's correct. Yeah, this is not
Right.
mRNA. This is just a killed virus.
Right. And they use this CoronaVac, which I think is Sinovac, or is produced by a Chinese company called Sinovac.
Yeah.
So they use that in one of the control groups. Let's go over this table here. What do we see?
Yeah, so as you can see, so for everybody watching, to understand this is first you want to start at the control group, right? You see control group at the top. So that's what it was in normal rats that didn't receive any shots, right? So and then you look at primordial, right? So that's that original source of the eggs, which then become activated into primary, secondary, as girls reach puberty. Those primordial follicles turn into these primary, secondary, and antral type of follicles. And so, but if we look at primordial, 106 for the control group, and then you see the mRNA vaccine group, it's at 42. And so that's more than a 60% reduction. And even if you look at the inactivated vaccine group, that is still about a 30% reduction. So it's still decimating the supplies there, but it's also cutting down on the other forms of follicles, right? So even the forms that have made it past the primordial stage are also becoming affected. Not all of them, but most of them, as you can see. And so, this is really terrible, to be completely honest. This should not be happening. This would only happen with a very toxic product to cause this much reproductive damage. This is really
Right.
is shocking.
What about the atratic here? Atratic means that these are kind of dying follicles, right? They are not healthy. They do no longer develop. Is that correct? Is that what they are?
Yes. So as you can see, it increased the number of these dying follicles in the mRNA
Yes.
vaccine group. And so,
Yeah, like it's almost twice, 13 and then 26 and 17 for the inactivated vaccine group. So what I thought was really interesting here was, well, first of all, this is really shocking, the primordial, the decrease in primordial follicles. But then when you go through the developmental stages here, all the way to the pre-ovulatory, which is an egg that can conceive, I thought this was really interesting. So it goes, as you can see, even in the control group, so people who didn't receive any vaccines, it goes down from 106 to 18, about 18. And in the, so dramatic decrease. And then in the mRNA vaccine group, it goes from 42 to 15. So that is much less of a dramatic decrease. So in the end of the pre-ovulatory follicles, the difference is not that great. It's 18 versus 15 versus 16. How do you explain that, Nick?
yeah, so it appears that, or I guess what this could mean is that while it won't, so it'll have not a massive effect on immediate fertility. It'll still have a negative effect, right? It still is this statistically significant reduction. So it will still have an effect, a negative effect on fertility with the pre-ovulatory follicles. But the biggest and most concern is since you see the primordial follicles have the 60% decrease, right? That means long-term outcomes are going to be absolutely detrimental, right? So while you might have only a little reduction now, in those active follicles, your reserve has been diminished. And so what that means is 10 years down the line, it's going to be pretty hard, likely, to have successful conceptions if this does indeed translate to humans.
So could that mean, for example, that women who got the mRNA vaccine would reach menopause earlier because their follicles have been depleted? Is that possible?
Yeah, that's also possible. That is also possible. So yeah, there's going to be much earlier menopause. And if little girls receive these right before puberty, we have no clue what that's going to do to that process. In fact, I don't even think there's one study assessing what happens when you give a toddler an mRNA shot. Right, there hasn't even really been enough time to see what's going to happen when they reach puberty, and so we don't even know. Maybe it'll just prevent it. I mean, we just don't know. So again, this has to be now investigated much further.
And then another thing you pointed out is that even for the inactivated vaccine group, so that's the traditional vaccines that we're used to before these mRNA shots came on the market. So even for them, there's a pretty dramatic decrease. I mean, look, from 106 in primordial follicles all the way down to 70. So I was really shocked about that because I had never heard, I had never been told that traditional vaccines reduce primordial follicles and all the way down to pre-ovulatory follicles. So does that mean that this is the inactivated COVID vaccine. Does that mean that this might translate to all inactivated vaccines that we get for all sorts of other stuff?
I don't know if I would say that this specific COVID inactivated vaccine would translate to other inactivated ones, because we know that specifically the SARS-CoV-2 spike protein is extraordinarily toxic. We know it's synthetic. We know it was concocted in a laboratory, and so it does appear that we would expect. I would think that still that the COVID inactivated vaccines are still likely more dangerous than the classical inactivated vaccines, like say for flu.
Okay. Interesting. So this would then point to the dangerousness of the protein that these vaccines are designed on, that they use for the vaccine, but for both technologies, inactivated and mRNA.
Yes,
Okay.
yes, and I bet the
Interesting.
mRNA group is seeing much larger effects, because we know now that the mRNA has a particular preference, or the lipid nanoparticles have a particular preference for the ovaries, as shown in animal biodistribution studies. And so, since there's going to be going directly into the ovaries themselves will be producing the toxic spike protein, and that's probably why we see much greater effects.
Yes, exactly. And we are going to look at exactly that. But I'm wondering whether there have ever been studies done for traditional inactivated vaccines that look into the impact on, let's say, the number of primordial follicles. Do you think such studies have been done ever?
I haven't seen any, to be honest. I don't think they have looked experimentally like this with other vaccines. I'd have to look. I can't say for sure, but I haven't seen any that I'm aware of.
Okay. So you already just mentioned that the actually, yeah. Well, I'll just keep sharing the screen because I want to go into a study that gives us some information about what you just said, namely that the lipid nanoparticles have some sort of partiality for ovaries, that they somehow accumulate in that particular organ. And I've looked at this study here. I'll just show you what it is. It's a very interesting study. I'll just scroll up so that you can see it. It's a non-clinical evaluation report by the Australian government from January 2021, so very early on. And what's interesting here is, look at this. So it's an evaluation report of the COVID mRNA vaccine. And look at the sponsor. The sponsor is Pfizer Australia. So does that mean, Nick, that Pfizer actually sponsored it in the sense of financially contributing to this non-clinical evaluation report of the Australian government?
Yeah, it appears so. It does appear so. And so, the fact that means they knew that these would go throughout the entire body, and they proceeded to administer them anyways.
But isn't that shocking? I mean, isn't that the greatest conflict of interest imaginable? That the product that is being evaluated here is being the report about this product is being sponsored by the company that produces this product.
It's
I
just
mean, well,
ridiculous.
it is complete. I mean, it's shocking, and how nice of them to even put it on there. I think you would think, oh my god, if I would do something like that, I would at least try to hide that. But it's just unbelievable. They put it right on there so that you know. Okay, we know this. So it's non-clinical. It's not doesn't involve a trial. This evaluation report is sponsored by Pfizer. All right, so let's go down and have a look at this. Okay, wonderful. So walk us through this table here. It says mean concentration of radioactivity, sexes combined. That, of course, is not true for ovaries. In tissue and blood following a single dose that was injected into of 50 milligrams mRNA injected into a rat. And also tell me what this has to do with radioactivity.
Yeah, so that's what they're using a particular compound to assess where it goes in the body to be able to measure it basically because they won't just be able to measure the lipids itself without the assistance of a compound. And I believe it's attached to the lipids. But I got to reread this study to know exactly what they used here. But regardless, this is their way of measuring where they go. And so what they found here is if you look at the top there, so 0.25 minutes, right? So that's right after injection, and you got an hour, 2 hours, up to 48 hours. Um, if you look at the 48 hours, you'll kind of see, where it really settled in the body. And so, as you can see, if we start off at the top there, adrenal glands, right? That's one of the highest concentrations in this table. So it really does have a preference for the adrenal glands. Does not stay in the arm like they claimed. And then we also have, yep, yep, we got adrenal glands, and then we have bone marrow, and so that now corroborates what we found in another recent study a few days ago that found metabolic reprogramming in the bone marrow after mRNA injection, and the metabolic alterations were that of leukemia patients, and with distinct alterations. And so it appears that they do indeed, as it shows, get into the bone marrow and cause leukemia. And so very, very bad stuff. And then we have the injection site, right? So injection site, of course, it's going to have the highest amount. Now, that was supposed to be the the only place where these lipid nanoparticles went, according to what they claimed, according to what our regulatory agencies told us. So that's a complete lie, obviously. And then we have the liver. So the liver has a pretty high uptake of these lipid nanoparticles as well. That's why we see vaccine induced liver injury. That is now a syndrome that we see popping up. And then we have ovaries in females. This is what we are truly worried about regarding fertility. As you can see, again, one of the most highest uptake, this organ, of the lipid nanoparticles. And then let's scroll down a little bit more. Let's see what else is pretty high here. Yeah, we got 23.35 for the spleen. So it gets into the spleen in high concentrations as well. But it's also found basically everywhere else, and albeit smaller concentrations, it still is detectable in all these other organs, which is very worrisome, right? We don't want this in any of these organs. We don't want modified mRNA resulting in toxic spike production in the brain, in the heart, in the eyes. I mean, we don't want it there. It's very dangerous. And so just this table should have prompted them to pause the rollout of these shots um, until proper human biodistribution studies were performed. But those still have not been performed, right? So this was in rats. They still haven't done it in humans. They have not even done it.
Yeah, right. So a couple of things here that I thought were really interesting. So first of all, it stops at 48 hours. I don't know what these measures are going to be after 72 hours or after 5 days or after 2 weeks or after 2 months. Can we make any kind of projections about whether this keeps increasing or where does it plateau? When does it stop?
Yeah, they should have had this study go on for a few months to really assess what was happening. Now, we could assume that, since this is the lipid nanoparticles, those will, um, that concentration will probably go down, honestly, in a few weeks. But that doesn't mean that the mRNA will start to go away. That doesn't mean the um, that the spike protein will go away. So we just have to remember this is just the lipid nanoparticles. So yeah, we would actually expect these to possibly go down, but again, we don't know. They still should have did this for weeks later, so we could truly see exactly where the lipid nanoparticles settled the most over time.
Right, right. And so the spike protein is enveloped in the lipid nanoparticle so that it can easier get into the cells, correct?
Yes. Yeah. Well. Yeah. Well,
So
the mRNA is within the lipid nanoparticles, and then that mRNA will get into your cell, go into your ribosomes, and then your own cells will start to produce the spike.
correct, correct. Which means that if we find lipid nanoparticles somewhere, that means the mRNA is there as well, and it will start producing the spike protein. And the other thing that I found really interesting here is the amount of time it takes, so measured up to 48 hours. For example, if you look at the adipose tissue here, after like 25 seconds, it's at 0.057, but after an hour, it's at 0.1. And then after 48 hours, it's at 0.81. So it doesn't, 0.181. So it doesn't increase that much between 1 hour and 48 hours. Whereas for others, look at the adrenal glands, for example. After 1 hour, it's at 1.48, but then after 48 hours, it's at 18.21. So it's a completely different growth. I mean, it increases really to much more. So, and then the liver, I mean, the liver has the highest uptake. Where is it? 24. Where is it here? Liver is here, 24. So,
If we look at the injection site, right? So look at the injection site,
yes,
128
yes.
first, and then it goes up, but then it starts to go down, but it increases in other organs. That's because those particles are leaving the injection site as time goes on, and then increasing its concentration in these other organs.
Oh, that's fascinating. I missed that. That's really interesting. So it starts very high after 30 seconds. Well, that's to be expected. And it goes up. It goes up. What's the time frame here? After 1 hour, it's at its highest. And then it goes down. Then it goes up again a little bit. And then it goes down, down, down. And well, probably it will continue going down, I would assume.
It'll
And then
continue
it
going down,
travels
but
through
it
the
will
body.
continue going up in the other organs.
Okay, so now we have this table here. I mean, that's a really incriminating table. And we have this table from January, this was January 2021. And they were telling us that the mRNA shots, that the mRNA, the spike, all that would stay in the arm, in the deltoid muscle. Isn't that correct?
Yep, that's what they claimed. Clearly, it was not true. It wasn't based on any data. They just made it up. And
Well, but based on this data, they knew that it wasn't true.
right, based on this, you're right. They should have came out and said right away, but I guess they wanted to pretend it didn't exist, and maybe I don't know. Maybe they just um, I really don't know what they thought, but this was clearly brought up. This was brought up many times across alternative media, right, when it came out, but it wasn't really talked about in mainstream media, and that's one of the main problems when we talk about these harms. It's not getting to the CNNs, it's not getting to the MSNBCs, and we really do need to get this information there. Um, but it's very hard because we know that they are all sponsored by Big Pharma itself.
Exactly. I mean, I wonder if anybody who would have seen this table before vaccination would have been told, "Oh, it's safe and effective. Don't worry about it." And here's the table. If anybody who would have looked at this table would have said, "What? What? Look at all this. Look at how this accumulates in all my organs. I don't want this shot. What's going on here?"
Right. Right. I mean, if I saw this table and I was a regulator, I would be like, no way we're going to give this to anybody. We can't have this experimental product going in every single organ system. It's just madness. And so
Mm-hmm.
um
Mm-hmm.
it's truly just at this point we could almost call it, a crime.
Mm-hmm. Oh, almost absolutely. I agree. So, and since I was looking at this report by the Australian government, sponsored by Pfizer, I found some interesting just by scanning it. I found some really interesting stuff. I just want to get your feedback on this. So, on page what was that? On page 13, it mentions that there were no genotoxicity studies conducted for the vaccine, and that this is in line with relevant guidance. I'm going to scroll over a little bit with relevant guidelines for vaccines.
Yeah, it's crazy, right? It's crazy to think about this. So they claim because other vaccines don't test for it, they didn't have to test this one. But we have to understand this isn't even a vaccine. This is a gene therapy product that they just claim is a vaccine. And so they tried to use all sorts of tactics to skeet around this genotoxicity studies and all these other studies, because if it was indeed a gene therapy, um, they wouldn't have been able to get away with this without this testing. So that's why they claim it's a vaccine here.
Mm-hmm, mm-hmm. And then they also say there were also no genotoxicity studies with the novel excipients, which is like the lipid nanoparticles, right? That is a novel excipient.
Right, right. Yep. So I guess it's so crazy when you read that because novel excipients, right? So that means new ingredients, never been tested before, and for some reason they don't have to do genotoxicity studies. Just ridiculous.
Yeah, and the reason here that they give is very interesting. They say, "Oh, the sponsor stated," no, that is Pfizer. It's Pfizer who stated that. The sponsor stated that the novel lipid excipients are not expected to be genotoxic based on in silico analysis. So you just put the stuff in silico and analyze it and say, "Oh, well, it's fine. We don't have to test it in humans." Wow.
Yeah, I mean,
Also, yeah, go ahead.
they really they really did a huge disservice to humanity by approving this base and doing all of this nonsense. I mean, how can they just look in a computer program and expect that to be sufficient data to administer to the whole world? It's just
Mm.
crazy.
Exactly. And then it's also very revealing how they justify. So they say the sponsor justified the absence of genotoxicity studies. How do they do that? And they do it with a strange concept that is called the threshold of toxicological concern. Here, this is the concept. So, and what does that actually mean? It's some sort of number game, some sort of, they say, oh, well, over a lifetime, or they call it a less than lifetime exposure of 70 years here, we are calculating how much of this toxic substance a human being can somehow be injected without without getting sick. And then they calculate this somehow based on some other stuff that they have and decide, oh, it's fine. But what was particularly interesting was this here. Look at this. Assuming the vaccine would be administered twice per year, every single year, twice. And that they said in January 2021, when there was no talk about, oh, you are going to need this mRNA vaccine for the rest of your life twice a year.
Yeah. So it appeared they knew beforehand what they were going to do, which was get a annual booster service and have people take them every single year. And so this is in line with that for sure.
Yeah, right. And then another thing that I found also quite shocking, it's further down, I think. Yeah, the carcinogenicity. So same thing. Impact on cancer. These studies were not conducted. And if you look at the explanation here, it's acceptable based on its duration of use. The novel, so the LNPs are not expected to be carcinogenic based on the low exposure, duration of exposure, absence of structure alerts for mutagenicity. What do you make of that?
This is again just nonsense. So they wanted to see, well, if it causes DNA damage, their computer programs claim it didn't cause any damage, and yeah, this is just a result of more of the games they play. Just claiming that they don't have to conduct it because their in silico computer analysis claimed it would be fine. Just ridiculous.
Mm-hmm. Mm-hmm. And then they also mention reproductive toxicity. So they conducted reproductive and developmental toxicity studies in rats. So they gave them the vaccines. I'm just going to highlight that. And they say they gave them twice, 21 days, 14 days before the start of mating, twice during gestation, was a very high dose. And they found that everything was fine with the pups, no problem. The study showed no adverse effects on female fertility, embryo fetal development, and postnatal development up to weaning in rats with these 4 injections.
So I guess do they define female fertility in this document? I'm just curious.
Good question. I don't know.
Because I
don't know
wonder if that
do.
definition doesn't include ovarian reserve. They could have did some more tricks and just define female fertility as something that wouldn't be affected. But this directly contradicts that study that we looked at previously.
Yes, I'm almost certain that they did not look at the impact on primordial follicles.
Right, exactly.
And then look at this down here. The exposure, this sentence here, the exposure of fetuses and pups to vaccine-specific antibodies was also demonstrated. So that means that they found antibodies in the fetuses and the pups, so the newborn babies. So doesn't that mean that it crossed the placenta, that it crossed from the placenta into the fetus?
Well, their claim is that it's just the antibodies that transfer, but that's not true. It is indeed the mRNA, the lipid nanoparticles. It has now been proven to cross the placenta and indeed reach the fetus, where it does translate into spike protein in the fetus itself. It just a disaster.
Mm-hmm, mm-hmm. And then the last thing that I want to point out here is the pregnancy category. So based on these findings, they decided, or the sponsor, so Pfizer proposed pregnancy category B1. Now, what is they say? Oh, this is considered appropriate for this product as no embryo fetal effects have been noted in the combined reproductive and developmental study in rats. So, tell me, what is this proposed pregnancy category B1?
And it appears that category B1 is an acceptable rating for products to be administered during pregnancy. I believe it's pregnancy category X is when it should not being given at all costs to pregnant women. So this should not be pregnancy category B1, which indicates it's safe in pregnant women. That's absolutely ridiculous. I mean,
Yes.
uh, even based on their own data here, the fact that a novel product literally gets into the reproductive organs, why would you give that to a pregnant woman? I have no clue. That's what's called experimentation.
That's a very good point. They have this long table there with horrific findings, and they're just like, oh, there's nothing to see here. Everything is fine. Don't worry about. I mean, it's like, what? They put the data in there, and then they just pretend that everything is okay. It's no worries about anything. Actually, I looked up. Let's have a look at these pregnancy categories. I was curious, what are they actually? And I'm just going to pull them up on Wikipedia. So yeah, so the X, as you said, it's contraindicated in pregnancy. The highest, the best, I guess, category is A, no risk in controlled human studies. But you get A only when you do adequate and well-controlled human studies have failed to demonstrate a risk to the fetus in the first trimester of pregnancy, which is the most vulnerable stage of pregnancy, and then no evidence of risk in later trimesters. But look at B. Now, this is categorized as B, whatever B1 is, I don't know. It says, no risk in other studies. Animal reproduction studies have failed to demonstrate a risk to the fetus, and there are no adequate and well-controlled studies in pregnant women. So this is the case for this mRNA COVID vaccines. They did these animal studies and say, oh, everything is fine, so let's give it to pregnant women, since we don't have well-controlled studies in pregnant women. Let's just give it to them.
Yeah. Well, what I'll say is at this point in time, it's definitely category X, right? It is
Oh, for
definitely.
sure.
Yeah,
Absolutely.
especially Dr. James Thorpe. He's conducted a few studies looking at pregnancy adverse events, and he found safety signals in the VAERS system. Basically, every adverse event you could think of: stillbirth, fetal death, miscarriage, all sorts
Yep,
of things.
exactly. And we are going to look at exactly that study next. But it should have been X from the very beginning. Once they had that evidence of the lipid nanoparticles going into every single organ and really accumulating in the ovaries, and then they give it to pregnant women. I mean, it's totally crazy. Also, look at this here. I didn't know that. It says or. So there are two different cases when you can get this category B. Or animal studies have shown adverse effects, but adequate and well-controlled studies in pregnant women have failed to demonstrate a risk to the fetus in any trimester. That's shocking. So does that mean, if I understand that correctly, Nick, it means we do animal studies, let's say with rats, and they show adverse effects, these studies. But then we would say, oh well, let's do a clinical trial with pregnant women to see if we get adverse effects as well. That's what it says, right?
Yeah, that's what it says, and they again, this just shows they should not have labeled it um, category B. Just when something is so brand new, and they already had preliminary evidence indicating widespread biodistribution before rolling them out to any pregnant woman, you know they that would require like decades of testing to understand how this novel genetic product would affect the fetus and its development and the baby's development as he or she grows up.
Mm-hmm, mm-hmm. So to go back to this first study on the impact on the follicles. Now this was a study where one of the control groups got the Pfizer vaccine, but the Moderna vaccine contains, I think, 3 times the amount of the amount that the Pfizer vaccine contains. So do you think that because of that, the impact on primordial follicles could be even greater?
It appears that now that we've seen a study, actually, the senior author on this new study is Florida Surgeon General Joe Ladapo, and they actually compared Pfizer to Moderna injections based on mortality outcomes. And they actually found that Pfizer vaccines were associated, people who received Pfizer faced a 36% higher risk of all-cause mortality compared to Moderna recipients, and that was with 1 million Florida adults. And so it appears that the dose might not make the poison here, which we don't really understand why. Why would Pfizer actually be more deadly? We don't know. Maybe it's actually just how small alterations in their mRNA modifications. Maybe Pfizer's is more stable, and you're going to get more spike production. We just don't know. Maybe Pfizer's has more DNA contamination and more contaminants in the lipid nanoparticles, resulting in reverse transcription at higher levels. We don't know. There's so many things that go into this, but just based on that Florida study, comparing the two, it does appear that Pfizer may be more deadly.
Yes, that was a very unexpected and interesting result. So we don't really know. There's so little we know, and so much that we don't know, and so much research that should have been done over the last years and needs to be done urgently now. I have one more question about the impact on follicles. I was wondering, since we now have seen that these nanoparticles really accumulate in the ovaries, high concentration in the ovaries, do you think that a woman that is vaccinated during pregnancy, I would think that it stands to reason that you would expect that even the primordial follicles in the fetus, in the female fetus, would be impacted?
Yes, most definitely. It only makes sense because if the lipid nanoparticles do reach the fetus, they will go into all the organ systems, including the developing ovaries and reproductive systems. And yeah, we would probably see destruction of those follicles at all stages of life.
Right, right. And interestingly, it seems that during gestation, what did I read? I think it was around the 20th week of pregnancy. Female fetuses have a much higher number of primordial follicles. It's something like 6-7 million compared to the 1 to 2 million at birth. So there's an enormous number of these follicles around. They don't all make it, but we really have no idea what the impact is. How much they are decimated during that particular stage. Now I would like to look at at another study, and this is the Czech study. It's called the rates of successful conceptions. Let's go. I think I have it here. Here we go. The rates of successful conceptions according to COVID-19 vaccination status, data from the Czech Republic. That's also a recent one. It was posted end of April 2025. So tell me about this study here.
Yeah, so this study looked at over 1 million individuals from the Czech Republic, from a Czech Republic database. And what they found was, again, they found that basically that animal data that we just looked at does indeed translate to human data, because women who received a vaccine before conception, compared to unvaccinated women, had 33% fewer or 33% less successful conception rates. And so basically, the vaccinated women that received the vaccine before conception had a much lower chance of having a successful pregnancy. And so that does indicate that their ovarian reserves may have definitely been detrimentally impacted, as we've seen in the rat studies.
Right. And successful conception, that actually means, when I first saw that expression, I thought, oh, it just means that you conceive, that you're successful in conceiving. But it actually means a live birth. So a conception that results in a live birth. So let's have a look at this table here. We have two histograms here. Maybe I can make it even a little bit bigger. Here we go. How is that?
Yes, that's
Okay.
perfect.
Yeah, so walk us through these two histograms, histogram A and B.
Yeah, so if we look at A there, percentage of women with at least one COVID-19 vaccine dose, right? And so as you can see, a majority of the population did receive one of these mRNA shots. So in 20, yeah. So by the end of 2021, right, a majority of the population got it. But the key point here is panel B, right? And if we look at the y-axis there, number of successful conceptions per 1,000 women, right? And then we look at if you look at the key, the legend in the top corner there of panel B, you got all women, vaccinated women, and unvaccinated women. So what's key here is you want to look at unvaccinated women, which is the white bar, and then look at the vaccinated woman, which is the darkest bar. And as you can see, um, unvaccinated women appear to have way more successful conceptions, far more successful conceptions than the vaccinated women. And just look at the stark contrast between those white bars and the dark bars.
Yeah, exactly. And there are a couple of interesting things here. Look at the early months in 2021, when only few people had received a mRNA vaccines. You have very, very few successful conceptions among the vaccinated, and it goes. I don't know why this in January 2021 extremely low. It's the lowest of all of them. Then it goes up, but then it goes consistently down until it goes back up again in July of 2021. So, I mean, maybe that's just a fluke. I mean, I don't know, but could it also be that some of these early batches were particularly toxic?
Yes, the early batches were definitely much worse, severe adverse event wise, than the newer batches, and that was found now. And 4 different studies looked at this batch variability, and they all did indicate that the early 2021 batches were indeed more dangerous. And so that does make sense that we see the most shocking contrast here early on in the campaign. Then it kind of levels out a bit as time goes on, but it still remains lower than the unvaccinated women.
Yes, and significantly lower. Now, of course, I mean, you could argue, oh, maybe vaccinated women for some reason don't desire to have many children or don't want to get pregnant. But I think it's so consistent over the years. It's kind of unlikely that would be the case.
Right. It's just too much of a difference to say. Now that could be a factor in it, but that's most definitely not the only factor. Now that we know they do severely damage the reproductive system.
Also interesting is the really high successful conception rate of the unvaccinated here between June and December 2021. It's like they had used the opportunity of the pandemic to get pregnant. I mean, it's so much higher than in 2022. Interesting result. Okay, so.
Well, people did get infected too with SARS-CoV-2, so that could have affected unvaccinated women to a degree. And we got all sorts of toxins now, other than the mRNA shots that are damaging reproductive systems. And so, but yeah, most of the population now, in fact, nearly all of the global population was exposed to the toxic spike protein, either from the injection itself or from infection. And so, this could have bad outcomes for the entire population. But clearly, the mRNA shots will be more damaging.
Yes, that's a good point. And it's a pity that we only have these 2 years and then 3 months. You want to really see it would be nice to have it way longer. But of course, that's what we have. But you can see that after this levels out here, these very high rates, it kind of goes back to normal. It goes down a little bit here in 2023. So maybe that, who knows? It might go back up again. No idea. But we don't know how the spike protein itself, just from the COVID infection itself, and also through shedding, might affect the pregnancy, the successful conception rates of unvaccinated women as well. We don't really know. And I think it's also concerning that if you look at these rates here of the vaccinated women, so in 2022, most of them, you can see here, it doesn't really change. The rate of vaccinations doesn't really increase much after the end of 2021, right? That's it. Maybe some got a booster shot, probably very few, just as here in the United States, not many people get booster shots. But you do not see in 2022 and the first 3 months of 2023 an increase of successful conceptions, which would have been hoped for, but it hasn't happened. And well, we don't know how it's going to continue. They do say in the study that the fertility rate in the Czech Republic went down over these years. That's not surprising, of course. We also don't know, the vaccinated women, we don't know how many of them conceived a child. This is just successful conception. It doesn't say how many got pregnant, how many had a miscarriage, how many had a stillbirth. All of this is hidden in here. So that would have been really interesting to see so and so many got pregnant and then they lost the child. Actually, let's go to the next study, because that will give us some information about that question. Yes, so let's go to the Thorpe study, because Dr. Thorpe, he's a very well-known obstetrician, has decades of experience. He did a study together with Dr. Peter McCullough, by the way, and other people. And I think I have this study here. Let's jump to that study. Yeah, let's scroll up to see the name of the study. Are COVID-19 vaccines in pregnancy as safe and effective as the medical industrial complex claim? And this is part 1. Here's Thorpe and lots of other people. There's Peter McCullough. And this was published, when was this? February 2025. So tell us about this study.
Yeah, so if we scroll down a little bit and we look at the methods, we'll look at the methods in the abstract section.
Where's the abstract? Here we go. Here.
Yeah, right here. Yeah, so they took the VAERS data, right, and they looked at what's called PRRs, proportional reporting ratios, and so what that means is they compared adverse events after COVID-19 vaccination to those reported after influenza vaccination. Now, we have to know that a PRR, proportional reporting ratio, greater than 2 indicates a safety signal or a safety concern. And so basically, in clear terms, if a adverse event after COVID vaccination is reported over 2 times more compared to a flu vaccination, there is a safety signal. And so they looked at the VAERS system and they found 37 serious breaches in safety signals for adverse events in pregnancy. And as you can see, it includes miscarriage, chromosomal abnormalities, fetal malformations, fetal arrhythmia, hemorrhage in pregnancy, premature labor. I mean, so it's just think 37. And They claim it's safe in pregnancy. No, that's ridiculous. This should be pregnancy category X.
Yes, that's right. And I think the PRR you said greater than 2, that's a signal. That's unacceptable. I think in here, what was it? What was it, like 60, 64 or something like that? It was incredibly high.
Well, if we go to the tables down,
Yes, let's go to the table and let's have a look. So there is the table. So they compared the COVID-19 vaccines, the mRNA vaccines, with influenza vaccines and also all other vaccines. And also, I should point out that that's up here, and we'll scroll back up because that's a really important point. The time period. So they included 412 months. So like since 412 months, so 24 years for the influenza vaccine and all the other vaccines, but they only included 40 months for the mRNA vaccines because there aren't more. That's all we have.
right.
So we have two very different timelines here. One is 10 times, more than 10 times as much as the other, correct?
Right. So that's what makes it even more strong, these findings, is that these injections were only out for a few months. And the flu shots, those were out for decades.
Yeah, so these numbers, when you compare these, you actually compare the 315 were accumulated over decades, or more than 4 decades, and these were accumulated over 40 months.
Yeah, so as you can see, and then actually scroll down to the next table. The next table has they should have a PRR table, dude. Yeah, here we go. Yeah, so proportional reporting ratio of 114. So basically, that means that COVID vaccines, compared to flu vaccines, resulted in reported miscarriages 114 times more often, and that's just within that 40 months. So it's truly that's a true safety signal, a true breach that hasn't been taken seriously by any regulatory agency.
And then also they have the PRR compared to all other vaccines. But if we go back in here to the adverse events raw data, you can see, first of all, miscarriage very, very often. Now, this is VAERS data, so the underreporting factor is something between, 30, I think is a conservative estimate, and a lot of people say it's 100. Nobody really knows, of course. What do you think is the underreporting factor?
Yeah, conservative one is 31, and that was calculated in a study by Jessica Rose, published in the journal Science, Public Health Policy and the Law. So that's kind of an established one if we want to be fair. But the true underreporting factor is likely over 100, because we did have a Harvard analysis that looked at the VAERS system. It was commissioned by HHS about a few decades ago, I believe. And they found that less than 1% of adverse events are reported to VAERS. Less than 1%. So that does mean that likely the underreporting factor is over 100. And so what that means is you're going to have the true number of adverse events is not what's going to be reported in VAERS. It's going to be 100 times higher.
Right, which would mean like 350,000 miscarriages.
Yeah, so I mean, this is truly serious stuff, and what's happened since the COVID pandemic hit and the vaccines hit is our regulatory agencies and those who have pushed the vaccines all of a sudden want to claim that VAERS is garbage. It doesn't tell us anything, and they try and claim that everything in VAERS is false and not linked to the vaccine. But nothing could be further from the truth. I mean, these are usually inputted by the healthcare providers, by the doctors themselves, and those who lie in VAERS face imprisonment and massive fines. So it's like, a vast majority of these are most definitely linked because the healthcare provider does suspect vaccine-induced damage. And so we got to still take VAERS seriously. We can't just claim that, it's all false. That's absolutely ridiculous.
So one thing here that's very interesting is all the problems with placenta. Look at this. There are things like placental calcification, placental infarction, which means the blood supply is being cut off, placental thrombosis and placental abrupt, all sorts of placental disorders. And when you look at the numbers, so some of them are relatively small, but look at compare the other two groups, influenza vaccine and all vaccines, almost never happens. There are things like here, placental thrombosis. It's 0 and 0 in the other two categories, but it happens with the mRNA COVID shots. So there are new phenomenon, new terrible things happening during pregnancy that we haven't really seen before.
Right, exactly. And that's probably because we have this novel technology and it's resulting in these adverse events that would not happen with previous classical vaccines.
Yeah, exactly. And the same is true for heart problems. Very, very high numbers. Look, fetal heart rate abnormality, all sorts of problems there. Fetal cardiac disorder. See the same thing, 0, 0 in the other two groups. Fetal vascular malperfusion, fetal arrhythmia, and also fetal cardiac arrest. So again, it's extremely rare usually. Hemorrhage in pregnancy is also rare, but here 164. And then, of course, fetal death, stillbirth. So that the fetus just dies in utero after, I think it's after 20 weeks, right? That it's considered a stillbirth and not a miscarriage.
Yes. So basically, this study makes it clear these are pregnancy category X, 100%.
Not just pregnancy. I mean, if it does that much damage to the fetus, I mean, it's not just going to go in there to damage a fetus, it's going to damage your own body too.
Oh, yeah. It degrades the entire body. Yeah. Degrades the entire body.
I was wondering, all these placental disorders, like, for example, placental infarction, so cutting off the blood supply to the placenta, can that be caused by blood? Could that be caused by blood clotting issues that are caused by the vaccines?
Yes, most definitely, likely so. And for all we know, these are linked to these white fibrous clots that are being detected in deceased individuals after injection. Now, this what we believe now are actually amyloid fibrils.
Yeah, and we are going to go into that next, into the McKern paper. That's the last paper we're going to look at. But I really like what Thorpe wrote here. What the authors wrote here. They say the Pfizer COVID-19 vaccines to be the most injurious and lethal medical product ever rolled out, with 42,000 casualties, including 1,223 deaths in just 10 weeks. That's the data that they hid from us.
Yeah, and it's crazy. It's crazy, and he lays it out all here in a nice, concise manner. And yeah, this is what it is. It's absolutely disastrous.
So now let's have a look. Oh, the last thing I want to mention here is there also, it's the mRNA is excreted into human breast milk. So it's like, the way he puts it is like vaccinating your newborn child by letting the child drink your milk.
Mm-hmm. Yep.
Because that's pretty much what it does, right?
Exactly. They find the mRNA in the breast milk. It is most definitely going to get in the baby if he is or she is breastfeeding.
And is it true that these shots, these mRNA COVID shots, are still promoted by all these associations, the American College of Obstetricians, and and some other of these societies, Society for Maternal Fetal Medicine, do they still promote shots for pregnant women?
Yes, yes. Even after HHS just came out and said we're not going to give them to healthy pregnant women anymore, all those groups came out right after and said that's ridiculous. We're still going to support mRNA shots for all pregnant women, and so they've completely lost their minds. And I wouldn't trust them. I wouldn't trust them with parking my car down the street, or I wouldn't trust them with anything at this point.
Yes, right. And what craziness to say that something so toxic doesn't have to be given to a healthy pregnant woman, but should be given to a not so healthy pregnant woman. Why would you give something toxic to anyone? But
Exactly.
certainly to someone who's already sick. Why would you give something toxic to someone who is already not doing so well? It doesn't make any sense.
Yeah, our government's unfortunately still going to be administering these mRNA shots to the majority of the population, which include because most of the population does have at least one of these comorbidities that they define, and we do know that those individuals with these comorbidities actually face a higher risk of vaccine damage because they already have a dysregulated immune system. And now we're just going to continue recommending them to those individuals. And it's so bad. And then they just approved the new next gen mRNA shot called mNex spike. Nex in Latin means violent death. And so these shots, literally, the branding is literally called Death Spike, and you can't make this.
Wow.
You really can't make this stuff up. So yeah, um, they're still pushing it. There's still mRNA ideologues within our governments, and they clearly do not care about human health, specifically the ones that are whoever's sitting there and is the one signing off on these approvals, like whoever's at the top making that decision, should probably be fired, right? Because why are we approving a shot that's called Death Spike with a 2.7% serious adverse event rate found in the clinical trials? I mean, so we're completely lost right now. We got to get back on track.
So now let's look at what happens to the fetuses that actually survive the mRNA shots that their moms got during pregnancy. And there is this paper by Dr. Kevin McCairn, not to be confused with Dr. Kevin McKernan, very similar names, but different people. Kevin McKernan is the geneticist. He participated in the Human Genome Project. And Kevin McCairn is a neuroscientist in Japan, and he has been analyzing these fibrous white blood clots that embalmers have found in corpses, and that also vascular surgeons have found are pulling out of live patients. And he published just recently, end of May, this article here, which has the title Amyloidogenic Fibrils in a Post-Gestational Case of mRNA Vaccine Exposure. Tell us about this. What did he do, Nick, and what did he find?
Yeah, so what happened was there was a child that was there was a fetus in the womb of a pregnant woman. This pregnant woman got one Pfizer shot, and then a few weeks later got the second Pfizer shot. This baby was born about a week after the second Pfizer shot with no vital signs. So he required emergency resuscitation. This baby and so we know that this baby was exposed to Pfizer mRNA in utero, right in the womb, is born without vital signs indicating severe damage from the vaccine. And then this child has been chronically ill with multiple surgeries since, getting reoccurring infections. So something is clearly gone wrong with this child. And so Kevin McCairn obtained blood samples from this child, this 3-year-old toddler, and found what's called amyloidogenic fibrils. So this is basically just misfolded protein, um, in this child's blood. And this is not normal, right? And yeah, there's the picture. Um, that's very these aggregates should not be in a toddler's blood, and we do know that the spike protein induces such protein misfolding, now shown in multiple studies, and so it appears to be a result of the in utero mRNA injection exposure, and so now he appears to have some sort of amyloidogenic condition.
And as you can see here on these pictures, these are kind of what you observe is microclotting. But these microclots we now know based on the research of Dr. Risa Pretorius in South Africa. She has studied microclotting, and she has come to the based on her studies, she has determined that microclotting actually eventually leads to macroclotting. It will lead to the formation of these white fibrous macroclots that cause strokes and heart attacks and all sorts of terrible things. And when you look at this picture, Nick, look at this here. It already looks like one of these twisted, weird strands, right, of misfolded fibrinogen, of amyloidic, it looks very similar, I think, already at this stage, even though it's just like it's 40x magnification of unfixed whole blood sample. The interconnected fibrils, they exhibit early phase amyloid bundling, but it already looks like these bigger clots later on.
Right, right. And so if you go up just a little bit to the green slide, that kind of confirms that this is indeed amyloidogenic. When they inject it with theoflavin, that does kind of show if something is an amyloid or not. And so they did confirm it there as well. And this is what could definitely happen before the formation of those large white fibrous structures.
Yeah, this is another one. I mean, this also really reminds me of these twisted structures, the much, much larger one. So the worry now, of course, is that this boy, he's 3 years old, and they find these microclots in his blood. So what's going to happen? How many years is it going to take until they actually develop into these larger clots? We don't know how to break down these clots because they are so tough and so indestructible that we don't really know what to do.
Right, right. And so we need to pour in all the research we can into this phenomenon. We got to figure out exactly what they are, how many people have them. We do know that former Air Force Major Tom Haviland did do a worldwide embalmer survey and found 83% of embalmers in 2024 reported seeing the white fibrous clot. So it's probably in a lot of people. But yeah, we got it. We got to start looking at treatments.
Yeah. And certainly the findings of Dr. McCarron here provide direct evidence that these components, the mRNA vaccine components, are definitely capable of reaching the fetus. I want to show you this last thing here. I looked at the comments to his article, and I want to show you this one comment. Because these are human beings. This is a 3-year-old little boy. It's the life of a little boy. And there is this comment here. Yeah, Cheryl Shepard. I guess Cheryl knows him because she writes, "He is a bright, tall, handsome boy with a sweet disposition and innocent soul. I do not know what his life expectancy will be, but he will be loved and loving others as long as he is drawing breath." So this is a person. This is a little boy whose life is probably going to be cut short and marred by all sorts of disease. Even in the 3 years, he has had all these operations and all the sickness caused by it.
Yeah.
And this is just one individual.
Yes, these are real people, real babies, real toddlers, real pregnant women, real families that are being shattered and have been shattered by the mRNA biowarfare program headed by DARPA in the military decades ago. And so, yeah, we we got to start treating these people. We don't want more families to be shattered, more family members to fall dead as a result of this. We really got to reverse this process.
So if we now look back at the results of the Czech study, these low successful conception rates for women, so they could be due to the impact on the primordial follicles. But there can also be another reason is probably the damage that the mRNA and the lipid nanoparticles are doing to the body and causing miscarriages, fetal death, and all these other terrible things that we just looked at in the table.
Yeah, it can be causing everything. It's just basically just think of it as you take an mRNA shot, you are decimating your reproductive system. It goes there, translates in the spike. Experimentally, it destroys the eggs, and it's clear these are reproductive toxins.
So what do you make of Marty McAree's comment not long ago when he said he was asked about giving a seventh, I think it was a seventh COVID mRNA shot to a 10-year-old girl, I think it was, and his answer was, well, he doesn't know. He doesn't know whether that girl should receive it or not because there's no data. What do you say to that?
Yeah, well, there's thousands of studies now showing the immense harms of these shots. So when they claim there's no data, they're being ingenuine. They're either lying or they don't belong in that position because they're unaware of the thousands of studies. And so, yeah, it's very disappointing to hear that from one of our top regulators at this point in time. That's not going to make America healthy again. What will is acknowledging the mass casualty event that has occurred since 2021.
Mm-hmm. Mm-hmm. Right. Also interesting, this Czech study, these studies are not done. They're not done in the United States. They're done in other countries, like in Turkey and not here. And we need to do so much research. We have to stop the shots. Have the shots been withdrawn from any market anywhere in the world?
No, Johnson & Johnson was withdrawn from America early on in the campaign, for like 60 reports of blood clotting. But for some reason, they didn't do the same with Moderna or Pfizer, which have many thousands fold more adverse event reports. But so they did that, and then AstraZeneca was pulled off from European and global markets last year. Um, they claim not due to safety concerns, just because nobody was getting it. But that's that's probably not true because AstraZeneca was quite dangerous as well. But at this point in time, COVID-19 vaccines are still being given worldwide. I believe every single country has at least one version on the market being given to the population. And so, yeah, they are still administering them in spite of mass death and harm.
All right. So don't get the shots. Don't get them when you're pregnant. Don't get them when you're not pregnant, because they're absolutely devastating. Thank you so much, Nick.
Thanks for having me.